occasion, I will present a journal that is very interesting and relevant to the development of the world of therapy today. And the title is Virtual Reality Application in Upper Extremity Rehabilitation of Post-Stroke Patients. Okay, stay tuned guys. Okay guys, according to the Rehab, stroke is the #1 cause of disability in the world. Then, how do we help patients regain the motor function? And can technology be the explanation? Yeah, we will discuss in the following presentation. And the first background of this journal. Yeah, do you know stroke is? What the meaning of stroke? Yeah, stroke is one of the most serious and dangerous diseases. According to data, stroke is the second highest cause of death in the world. And more than that, many stroke patients actually have to experience long-term disability. One main impact is 55 and 75% of stroke patients experience motor deficit in the first 3 until 6 months after stroke, especially in the upper extremity, such as the arms and hands. For the reason, effective rehabilitation intervention is needed.
The disorder causes patients to have difficulty performing basic daily activities such as eating, combing their hair, writing, or simply picking up objects. Now, technology is present as an innovative solution in the world of health. One of them is virtuality or VR, which is starting to be widely used in neurological rehabilitation. VR is digital simulation technology that provides a real-world experience through visuals, sounds, sometimes touch. In the context of stroke therapy, VR helps patients practice movements repeatedly through games or simulations of daily activities. VR also allows patients to do repetitive exercise with simulations of real or game-based environments. This approach is being shown to make patients more motivated, less bored, and more activity underway through the rehabilitation process. Okay, the next object of this study itself is determine the effectiveness of using virtual reality technology in the rehabilitation of the extremities of post-stroke patients. To answer this object, the author conducted a literal review of 10 scientific journals, both national and international, that directly discuss the implementation of VR in stroke patients. Next, the research result. This is study literal review of 10 scientific journals that discuss of the effectiveness of using virtual reality in upper limb rehabilitation in post-stroke patients. The result of the analysis show that all the journals reviewed provide positive and significant results on improving limb motor function in stroke patients. But in this subacute and chronic phase, some important findings from the journal show. First, the use of VR combined with conventional therapy has been shown to be more effective than using conventional therapy alone. For example, in the study of Elkafi et al. 2021, the group that received combined therapy showed a significant increase in ARAT and WMFT scores, which measures arm and hand motor function.
VR data such as 90 keyboards and have a positive effect on balance, motor coordination, and group strength. Third, patients are more motivated to do the exercise because the approach is fun and interactive. Fourth, several studies have also explored lens-free VR and non-immersive VR, as well combining them with other technologies such as functional electrical stimulation and robot-assisted therapy. 5. The results show a significant increase in range of motion or ROM, motor control, and neuromuscular activation. 6. Studies with RCT design and pilot studies showed that regular training session using VR 3 to 6 weeks can accelerate the recovery process. Recently, learn intensively and consistently. 7. Although the results are positive, effectiveness of VR therapy is still influenced by individual factors such as location and extent of brain damage due to stroke, patient age, like side stroke, acute, subacute, and chronic, level of participation and motivation during therapy. So, what are the benefits of using virtual reality? Okay, the use of VR in stroke rehabilitation provide a number of important benefits. First, increase patient motivation because VR offers a fun and interactive therapy experience. Second, increase the frequency of exercise because patients are more interested about doing repetitive exercise. Third, trigger repetitive exercise or motion repetition, which are very important for neuroplasticity, where neuroplasticity is the brain's ability to reset new neural pathways after injury. Fourth, adjust to the patient's ability, both visually and the level of default of the movement, so I can be used for coordination with stroke patient. 5. Can be done independently, essentially in home-based VR technology or home-based rehabilitation.
And finally, so the conclusion are, from the result of this literature review, it can be concluded that virtual reality has proven effective and significant in helping the rehabilitation of upper extremities in stroke patients. When used in conjunction with conventional therapy, virtual reality can provide better and faster results. However, it should be noted that the effectiveness of virtual reality is highly dependent on the location and severity of the stroke, as well as the type of virtual reality technology used. Further research is recommended to focus more on the most effective type of virtual reality, as well as considering the part of the brain affected in the each patient. Well guys, that's my journal presentation on the use of virtual reality in the rehabilitation of stroke patients, especially in upper extremity motor function. And hopefully, this information can be a new insight and inspiration for us to continue and utilize technology in the world of medicine and physiotherapy. Recovery is not race, it's a journey, and every tool matters.
Okay, thank you for your nice attention.